Have you ever been scrolling online and stumbled across a totally terrifying claim about your daily medications? Today, we're diving straight into a really frightening rumor in this explainer, the idea that your standard run-of-the-mill blood pressure pills might actually be destroying your leg circulation. I mean, think about it, a pill meant to protect your heart somehow ruining your legs. Sounds crazy, right? Let's break down exactly what's going on here. So, let's uncover what the actual medical research tells us. Because despite those super dramatic, clickbaity headlines you might see, there is literally zero published clinical data where researchers gave seniors these drugs and found their leg circulation, quote-unquote, destroyed. None. So where on earth is this alarming rumor actually coming from?
Well, it all traces back to a massive mix-up between two wildly different medical events. Look, harmless fluid leaking into your tissues is absolutely not the same thing as blocked arteries starving your legs of blood. Poor circulation, that involves a physical, literal roadblock preventing oxygen-rich blood from getting down to your toes. Swelling, or edema, is just fluid pulling up. Understanding this one key difference is the secret to unlocking this whole mystery.
To see how this kind of confusion plays out in the real world, let's talk about Mary. She's a 72-year-old grandmother who was recently prescribed a very common blood pressure medication called Amlodipine. And being a great patient, she followed her doctor's orders to the letter, taking her pill every single morning.
But after a few weeks, Mary noticed something pretty alarming. Her shoes were feeling unusually tight in the evenings, and her ankles looked undeniably puffy. Looking down at her swollen feet, she made a perfectly logical but completely incorrect assumption. She panicked, thinking the exact medicine supposed to save her heart was actively choking off the circulation to her legs.
Naturally, she rushed straight to her doctor in a total panic. But the actual diagnosis? Completely normal circulation. Her arteries were perfectly clear, like wide-open highways. The medicine had simply caused some fluid to build up in her ankle tissues. It absolutely did not block her blood flow. And you know what? With a super simple adjustment to her treatment plan, the swelling completely vanished, and thankfully, so did her anxiety.
So why does that fluid buildup even happen in the first place? Well, amlodipine lowers your blood pressure by relaxing those tiny blood vessels. When they relax and open up, the pressure drops, but a little bit of fluid tends to seep out into the nearby tissues, and bam, you get that annoying ankle swelling. Now contrast that with a drug like Losartan. Losartan lowers blood pressure by totally blocking a vessel-tightening hormone, which usually means you avoid that fluid leak entirely.
Now, hearing that, Losartan might seem like the obvious winner, right? But hold on, because it comes with its own unique set of trade-offs. While amlodipine might bring on the puffy ankles, Losartan can actually cause dizziness, especially if you stand up a bit too fast. And it can mess with your potassium levels, which means you're going to need regular blood tests to keep an eye on things. The truth is, neither drug is perfect. They just do their jobs a little differently.
And that brings us to a really crucial point. Doctors don't look at these drugs as some sort of contest with a clear-cut champion and a villain. Comparing medicines isn't about deciding which one is officially good or bad. It's entirely about choosing the right treatment for the right patient. Think about it. What works completely flawlessly for your next-door neighbor might actually cause really uncomfortable side effects for you.
This is exactly where highly personalized care comes into play, because your underlying conditions really dictate the prescription. For instance, a patient dealing with diabetes is very often prescribed Losartan, thanks to its proven track record of protecting kidney function. On the flip side, someone managing specific types of chest pain might be given amlodipine because its vessel-relaxing properties brilliantly improve blood flow right to the heart. It's literally like a master mechanic picking the absolute perfect tool for a very specific engine.
Okay, all that being said, we definitely need to talk about when you should actually start to worry. A little gradual ankle swelling, that's an expected run-of-the-mill side effect of amlodipine. But there are massive red flags you cannot ignore. We're talking about sudden coldness in your legs, pale skin, numbness, or extreme pain that suddenly gets better the second you sit down. That is absolutely not medication swelling. Those are the blaring alarms of an actual blocked artery, and that requires immediate, drop-everything emergency medical attention. But listen, if you're just dealing with some mild swelling, here is the absolute most important takeaway from this entire explainer. Never, ever stop taking your medication on your own. Quitting your pills cold turkey just because your shoes feel a bit tight is incredibly dangerous. The silent, invisible damage of an untreated stroke or a heart attack is infinitely worse than dealing with a pair of puffy ankles. Trust me on that one. And the good news? You absolutely do not have to just suffer in silence. If you just talk to your doctor, they have 3 highly effective tools right in their back pocket to manage this stuff. They might just lower your dose a bit, maybe add a complementary medicine that naturally flushes out that fluid retention, or they could simply switch you to a totally different medication altogether. It's usually a super easy fix when you let your doctor guide the way.
Now, beyond the doctor's office, there are things you can do to actively support your circulation, starting right this second. First off, take your meds exactly as prescribed, and write down your blood pressure regularly so your doctor actually has good data to work with. Keep an eye out for any totally new symptoms. And honestly, most importantly, keep moving. Staying physically active, even just going for a brisk walk, is fantastic for blood flow. Oh, and try to lay off the extra salt, since sodium basically acts like a giant magnet for fluid retention.
Because at the end of the day, really healthy circulation depends on so much more than just popping a single pill. It's about your diet, your daily activity, and having honest, open conversations with your medical team. So I want to leave you with this one question. Are you going to let sensational internet rumors dictate your health, or are you ready to march into your doctor's office and ask what the perfect, customized balance is for your heart and your legs? Don't panic, guys. Just get informed. Thanks so much for diving into this explainer with us.